Knock, knock, knock. Hi, my name is Karen. I'm going to be your student nurse today. Can you tell me your name and date of birth?
Jessica Hody, 01/29/2001.
And do you have any allergies?
No.
All right, great. So today we're going to go ahead and we're going to do a physical assessment. I'm just going to check you out head to toe and I'll let the doctor know my findings. Do you have any questions for me? All right. Can you tell me where we are today?
Madisonville.
And do you know who the president is?
Donald Trump.
Patient is alert and oriented ×3. I'm just going to go ahead and take a look at her. I'm looking to make sure everything is symmetric, that her shoulders line up symmetrically, her head is midline, it is normocephalic. I'm just looking to make sure all structures are symmetrical. I'm going to go ahead and feel your temperature. I'm just feeling that she is warm, she's dry. And check her skin turgor. Less than 2 seconds. Capillary refill. Less than 2 seconds. I would check that bilaterally. All right, are you in any pain today?
Nope.
Okay, I'm gonna go ahead and get a set of vital signs on you, okay? I'm gonna start out with the blood pressure. You lift your arm up for me, thank you. Patient's blood pressure is 118/68. That's a good blood pressure. Do you have any lesions throughout your body that I should know about? Any new bumps, anything that's come up that's abnormal for you? All right, great. I'm going to go ahead and check her pulses. Get her radial pulse. All right, her heart rate is 82 and her respirations are 18. I'm going to go ahead and feel her brachial pulse. It is palpable, a 2+ regular rate, regular rhythm. Her radial pulse was a regular rate, regular rhythm as well, and it was a 2+ as well. I'm going to go ahead and wash my hands, put some gloves on, and I'm going to be taking a look at your scalp, okay? Have you noticed any flaking, any lesions, any pain, anything like that?
No.
Have you been having any headaches?
No.
All right. Her scalp is white, pink. It is, her hair distribution is normal for her age. I'm not feeling any masses. I didn't notice any lesions, any pain. Do you have any pain in your head?
No.
No tenderness noted. I would then take my gloves off, wash my hands. Her color is appropriate for her ethnicity. I'm going to go ahead and I'm going to feel her temporal artery. It is palpable, elastic, +2. I'm going to move down. Have you been having any sinus troubles?
Mm-hmm.
All right, I'm going to go ahead and I'm going to palpate your sinuses. Frontal, any tenderness?
No.
Maxillary, any tenderness?
No.
Great. So then I'm gonna go ahead and I'm gonna move down to her ears. I'm looking to make sure that they are symmetrical, that all external features are present. I'm not noticing any lesions, any bumps, crustaceans, drainage. Now I'm going to move down to her eyes. I'm noting that all external features are present. Her eyelashes fan outwards. I'm not noticing any crustaceans, any lesions, any drainage. I'm going to go ahead and take a look at your conjunctiva. Her conjunctiva is pink and moist. Her sclera is white. I'm going to go ahead and measure her pupil size. Her pupils are a size 4, which is appropriate. They are round. They are symmetrical. I'm going to go ahead and have you look at that picture on the wall for me. And look at my pen. And then back at the wall. Thank you. Can you follow my pen light without moving your head? Great. And I'm going to shine a light in her eyes. If you could just look forward for me. Cranial nerves 3, 4, and 6 are intact. I'm just going to have you go ahead and stand up and we're going to do what we call a whisper test. If you could step forward for me. And if you could repeat the word that could you cover this ear? I'm sorry. And if you could repeat the word I say back.
Popcorn.
Cranial nerve 8 is intact. I would check that bilaterally. You can go ahead and have another seat for me. Thank you. And I'm looking at her nose. Her nose is symmetrical. It's midline. Do you have any history of a broken nose, nasal surgery, a deviated septum, anything like that? All right, great. If you could look up for me. Her septum is midline. Her nasal mucosa is pink and moist. I'm not noticing any lesions, any crustaceans, no abnormal drainage. And she said that she's not been having any issues with her sinuses. Could you go ahead and smile for me? Puff out your cheeks. Cranial nerve 7 is intact. If you could open up for me, I'm going to take a look at your tonsils. Say ah. Tonsils are a grade 1. All teeth are present. Her buccal mucosa is pink and moist. Could you lift up your tongue? Her soft palate and hard palate are intact. Could you stick your tongue out? Could you move it side to side? Cranial nerve 12 is intact. And then I'm going to go ahead and if you could swallow for me. Her gag reflex, which is cranial nerves 9 and 10, are intact. Her trachea is midline. I'm not noticing any lumps, bumps. As I mentioned before, her head is normocephalic. She seems to have good control of her head. Could you do chin to chest for me? And back and roll it in a circle. She has full range of motion of that neck. And because she has good control of her head, I would go ahead and give her a muscle grade of a 4+. Could you shrug your shoulders for me? And could you roll them in a circle? Great. I'm not noticing any crepitus. She has full range of motion of those shoulders and no abnormalities found. Could you go ahead and stick your arms out for me? I'm making sure that her arms are symmetrical. Don't let me push your arm down. Don't let me pull it up. Great. Could you bend your arm up? While she did that, I was also noting her range of motion of her elbow. She has full range of motion of that elbow. Could you pull? Don't let me push. Great. I would give her a muscle grade strength of 4+ of those upper extremities. Could you squeeze my hand or my fingers? Thank you. Her hands have a muscle grade strength of a 4+. Could you do each finger to your thumb and then back again? Great. Fine motor skills are intact. I'm going to go ahead and have you stand up for me. And at this time, I'm going to assess her lung sounds. Could you go ahead and face the camera for me? One, 2, 2, 3, 3, 4, 4, 5, 5. If you could turn around. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9. Great. All lung sounds are present. They are all clear. I'm going to go ahead and look at her chest configuration. It is a 2-to-1 ratio. Her effort of breathing is effortless. Her chest is rising and falling evenly. Do you have any tenderness?
Mm-mm.
Great. And are you having any difficulties breathing? Any kind of congestion, a cough? All right, great. So then I'm going to go ahead, I'm going to listen to her heart sounds. So I'm going to move over to this right sternal border at that second intercostal space. This will be her aortic valve. Heart sounds are present. I'm going to move over to the second intercostal space at that left sternal border. That is her pulmonic. I'm going to move down to the third intercostal space. That is her Erb's point. Fourth intercostal space. That is her pulmonic valve, or I'm sorry, her tricuspid valve. Fifth intercostal space, mid-clavicular line. That is her mitral valve. I'm going to go ahead and listen for a minute for that apical pulse. That apical pulse is 82. All heart sounds were present. S1 and S2 were noted. No murmurs were noted. While I have you standing, I'm going to go ahead and have you stick your leg out for me. And could you move it in a circle? Great. Full range of motion of that hip. Could you just roll it in a circle for me again? No crepitus noted. Could you bring your knee up and then back down? Great. She has full range of motion of that knee. Can you go ahead and do it again? No crepitus noted. I would check this bilaterally. You can go ahead and have a seat for me. If you could scoot your butt forward so I can check the muscle strength of your legs. All right. In the ideal setting, I would have it so that her legs were slightly above the ground so that she would not be having to sit in an awkward position. Don't let me push. Don't let me pull. Great. I would give her muscle grade strength of a 4+. At this time, I would wash my hands and I would put clean gloves on as I will be touching her feet. All right. So, if you'd stick your feet out for me. Don't let me push your feet down. Don't let me pull them. Great. I'm going to go ahead and assess for any swelling, any edema, none present. I'm going to check that dorsalis pedis pulse. It is palpable, 2+. I'm going to move over for the posterior tibial. It is palpable at a 2+. I would go ahead at this time and inspect in between each toe, looking for any lesions, any sores. Are you a diabetic? All right, great. So then I would take my clean gloves off and wash my hands again. No edema was noted. As I said, her lower extremities had a muscle grade strength of a 4+. If I could just have you come lay down for me. I'm going to assess her bowel sounds. All right. In the ideal setting, she would be in a hospital bed so that she would not be in such an awkward position. You want them supine, laying flat. I'm just going ahead and looking at the appearance of her abdomen. I don't notice any pulsations. It is flat and non-distended. Have you had any issues with your bowel movements? Do you know when your last one was?
Yesterday morning.
Great. And do you have any issues voiding urinary? As your urinary patterns, have there been any changes? Everything's within normal limits for you?
Mm-hmm.
Great. So then at this time, I'm going to go
I
ahead
couldn't quite hear you.
and
Could you please repeat what you said?
and listen to her bowel sounds. I'm going to start in the right lower quadrant.
I'm not sure I'm hearing you correctly. My apologies.
Right upper quadrant. Left upper. Left lower. I would listen to each section for 15 to 30 seconds to note her bowel sounds. If there were none, I would listen for a full 5 minutes. Her bowel sounds are normoactive, I'm sorry. At this time, I'm going to go ahead and palpate. Do you have any tenderness? No tenderness noted. And as I said, it is flat and non-distended. I'm going to go ahead and wash my hands. This has concluded our physical assessment. Do you have any questions for me? Great. If you need anything, just go ahead and let us know and call, and we'll be here for you, okay? Thank you.